Mr. McDaniel, my patient has a tracheostomy, and I think site care is done daily. Is that right?
Yes, usually daily or more often as needed.
Well, we reviewed trach care and practice in the skills lab, but I've only taken care of one patient with a tracheostomy before. Can you help me?
Of course, Marissa. I'd be happy to help you. Now, there are several steps involved in caring for a tracheostomy site, including replacing the disposable inner cannula, cleaning the stoma site, and replacing the stoma dressing and tracheostomy collar. What can you tell me about each of these interventions?
Well, the inner cannula needs to be replaced regularly to prevent accumulation of secretions that can interfere with respiration and occlude the airway.
That's right. And why is it important to replace the dressings?
Soiled tracheostomy dressings can put the patient at risk for the development of skin breakdown and infection.
Correct. So you must regularly change dressings and the tracheostomy collar.
Right. And I have to clean the skin around the tracheostomy to prevent any buildup of dried secretions to protect against skin breakdown.
Good. And because the respiratory tract is sterile and the tracheostomy provides a direct opening to that tract, meticulous care is necessary.
So I'll be sure to use aseptic technique.
Any more questions or concerns right now?
No, but I may have questions once we get started. I really appreciate your help.
It's what I'm here for. Okay, now, one thing you'll need to do before you start is to gather your supplies. So what emergency equipment should already be accessible at the bedside?
That would be a bag valve mask, oxygen, the obturator from the current tracheostomy, a spare tracheostomy of the same size, plus a spare tracheostomy one size smaller?
Right, and suction equipment.
Right. Okay, I think I'm ready. Let's get the supplies and go see my patient.
Lead the way.
Mr. Marks? Hi, it's me again, Marissa. And this is Mr. McDaniel, my nursing instructor.
Hello.
Since your tracheostomy is keeping you from speaking right now, you can just nod yes or no to respond to my questions. Does that sound okay? Okay, great. We're going to perform your tracheostomy care, okay? Thanks, Mr. Marks. Can I see your ID, ma'am? Thanks. Harry A. Marks? Great. And your birthday is January 21st, 1944. Great. Thank you. Now, before I get started, are you in any pain? If you were in any pain, I would address this first.
Right.
I'm going to start by changing the inside part of the tracheostomy, then the dressing on your neck, and the collar that holds it in place, okay? Now I'll make sure to announce each of my actions aloud so you know what I'm doing. If at any time you have pain or feel bad in any way, signal me and I'll stop right away. Now let's agree on a signal. How about if you make your right hand into a fist and raise it slightly in the air like this? Can you do that for me? Great, so you understand that signal from you means I should stop what I'm doing. Okay, in addition to any pain, you should let me know if you're having any difficulty breathing.
First, Marissa, put the bed at a good working height.
Okay, and I'll lower the side rail, and I'll elevate the head of the bed to at least a semi-Fowler position. Okay, now I'll bring the overbed table in close and up to about the height of my waist. Okay, and put a trash receptacle right here so it's handy.
If the patient were unconscious, what would you do differently?
I'd place the patient in the lateral position facing me instead of in semi-Fowler's position.
Okay, good. Now, assess Mr. Marks' respiratory status, including his respiratory rate, oxygen saturation, and lung sounds.
Okay, Mr. Marks, I'm going to listen to your chest, okay? All right, respiratory rate and depth seem good. Oxygen saturation also looks fine, 98%.
All right. Now ensure that you have the emergency equipment we discussed earlier accessible in case you need it.
It's right over there.
Good. So, what's next?
Let me set up. Okay, I carefully open the package with a new disposable inner cannula, being careful not to contaminate the cannula or the inside of the package.
Good. Now, carefully open the package with the gauze squares, taking care not to contaminate them either.
Okay, got it. Now I'll open the sterile cup and fill it with about a ½ inch of saline.
Good. Okay, now open the sterile gloves and place them within reach on the table. Then open the plastic disposable bag and place that within reach as well.
Then I put on the face shield and the non-sterile gloves. Here we go, Mr. Marks. I'm just going to put this pad on your chest.
First, remove the oxygen source. Good. Now, stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Good. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release the lock. Now, gently remove the inner cannula and place it in the trash bag. Very good. Then remove the sight dressing and dispose of it the same way.
So now I discard these gloves and put on sterile gloves. How are you doing, Mr. Marks? You all right? Good. Then I pick up the new inner cannula with my dominant hand, and I stabilize the faceplate with my non-dominant hand. And I gently insert the new inner cannula into the outer cannula. And I press the tabs to allow the lock to grab the outer cannula. And then I reapply the oxygen source.
Very good, Marissa.
Now I'm going to apply a clean dressing and a new collar.
Okay, but first, assess the insertion site. Look for any redness or purulent drainage, okay?
Okay. It looks good. If either did exist, it may indicate an infection, right?
That's right. Now, remove the oxygen source again. Dip a gauze sponge in the cup with the sterile saline and clean the stoma under the faceplate, moving from the stoma site outward and using each sponge only once.
Now I pat the skin gently with a dry 4x4 inch gauze sponge.
Good. Now you'll slide a commercially prepared tracheostomy dressing under the faceplate.
Okay, all done. Now I'm going to change your tracheostomy holder, Mr. Marks, okay? But for that, I'm going to need the help of a second nurse. Okay, Mr. McDaniel?
Okay, Marissa, talk me through what you want me to do.
Just hold the tracheostomy tube in place while I remove the old collar and place the new one.
First, I'll put on some gloves.
Ready? Okay, here we go. You hold the faceplate while I pull up the Velcro tabs and gently remove the collar. Can you turn your head? I don't see any skin breakdown on the posterior portion of the neck. Do you see anything, Mr. McDaniel?
Nope.
Now that could happen if there were any irritation or pressure from the tracheostomy holder.
That's right, Marissa.
Great. Now I'll put the collar on the patient's neck and insert the tabs. Can you lift your head up? Great. First one tab, and then the other. and secure the Velcro tabs on the tracheostomy holder.
Very good. And next you need to check the fit of the tracheostomy collar.
I should be able to fit one finger between the neck and the collar. And then assess whether the patient can flex his neck comfortably. Mr. Marks, can you bend your neck? Does that feel okay? It looks like the collar fits fine.
Good. Now, reapply the oxygen.
Let's clean up.
So now what?
I reassess the patient's respiratory status, including respiratory rate, oxygen saturation, and lung sounds. Okay, Mr. Marks, let me take a listen again. All right, respiratory rate and depth unchanged from my assessment before tracheostomy care. Oxygen saturation also looked fine, still 98%.
Good. Good. Now, finally, you're going to document your pre- and post-assessments, including the site assessment, presence of pain, lung sounds, and oxygen saturation levels. And also document that we changed the inner cannula, cleaned the stoma site, and changed the tracheostomy collar.
Okay, that about does it. All finished. Mr. Marks, you have your call bell right here if you need anything at all. Can I get you something before we go? Thanks, Mr. Marks. Again, call if you need anything and someone will come right in to help you.